Good evening, ladies and gentlemen. My name is Rhonda Copeland, and I am the National Director of the Federal Emergency Management Agency. Ladies and gentlemen, I want to share some very important and life-saving information with you this evening. Our nation is under a state of emergency. In 21 states in our nation. Here's what we know. On December the 15th, Merck Laboratories, one of our largest research facilities in the country, released a vaccine that is commonly used for the annual influenza virus. That batch of vials were released in September, and the vaccine mutated, forming a deadly injection. The vaccine was distributed in 21 states within the Northeast region and the Midwest region. When the vaccine comes into contact with the body's T cells, within 30 days, mutation occurs, causing severe symptoms, including diarrhea, headaches, vomiting, and fever. The mutated vaccine then attacks the nervous system, causing paralysis and/or death. To date, we know that there have been 256,987 cases of paralysis. There have been 54,267 cases of death. The CDC received thousands of reports of this mystery disease, and through their investigation were able to trace the mutation vaccine batch. Not all who were paralyzed have died, but they do remain in a comatose state. We know that 75% of the vaccine was distributed, and that the remaining 25% is on its way back to the CDC for analysis and for them to develop a counter vaccine. The numbers are staggering, but through the nation's National Incident Management System, we are able to coordinate all federal, local, and state health agencies in an effort to combat this national emergency. These agencies that are involved include the CDC, who is working around the clock to develop and distribute the counter vaccine. The agency that I represent, the Federal Emergency Management Agency, better known as FEMA, is coordinating all of the agencies and is working with the emergency management teams in each state to set up tent hospitals to treat the sick and dying. The Department of Homeland Security is also investigating the possibility of a terror attack, and they are deploying every resource available to track down any possible sources. The Food and Drug Administration is working with the CDC on a counter vaccine. The Secretary of Health and Human Services has deployed scientists from across the globe to assist in these efforts to create a counter virus. The American Red Cross, along with the National Guard, will assist with triaging patients at the tent hospitals that are being set up in each state that's affected. I want to assure the public that we are doing everything we can to save lives. If you or anyone you know has come in contact with the vaccine in the last 3 months, Please do not wait to become symptomatic before seeing a healthcare provider. If you are already symptomatic, seek medical attention immediately. Listen to your state health officials for directions on where to get medical treatment. We will update the public as soon as we have additional information. This is a serious national emergency. Please help us to help you by following all recommended steps to save lives. Thank you and good evening. It's horrible.